Miss Maria, we are live. The floor is yours.
Okay, ma'am. Hello, everybody. Good morning, good afternoon, and good evening, and welcome to the today's last session of the 1 Million Leadership Fellowship Program, Mental Health and Wellbeing Skill. It is indeed a pleasure to have you all joining us from across the globe. I am Maria Hayat, a pharmacist and MPhil scholar currently serving as a lecturer at Jawad Medical Institute in Pakistan with a 2 year experience with World Health Organization as an outreach surveyor and currently serving as a Women Ascension Community Outreach Fellow. For those joining us for the first time, I would like to introduce Women Ascension. So, the Women Ascension is a global non-profit organization dedicated to empowering individuals, especially women, by promoting leadership development, driving meaningful impact, and promoting self-sustainability through inclusive and diverse platforms. Operating across 5 continents and reaching 90 countries, the organization aligns its mission with United Nations Sustainable Development Goals. One of the organization's most current, active, impactful initiatives is the ambitious 1 Million Leadership Program 2030, which aim to empower 1 million women worldwide by the year 2030. This initiative is designed to enhance women's leadership, improve quality of life, and promote sustainable economic development through inclusive and diverse platforms. Empowerment on the global scale. The Women Ascension anchors the community outreach by creating greater access and awareness at the grassroots level. Today's session, entitled Holistic Approaches, Mindfulness, Nutrition, and Lifestyle, we will explore how mindfulness, stress management influence emotional resilience, the powerful role of balanced nutrition in supporting physical and mental health, the impact of healthy lifestyle habits in preventing chronic illnesses, the importance of sustainable routines for long-term well-being, practical way to integrate holistic health practices into schools, workplaces, and community programs. It's my honor to introduce today's speaker, mentor, Ms. Nurul Huda, who is currently pursuing her MPhil in food and nutrition and also been working across public health campaigns and youth-led advocacy initiatives. She is currently serving as a freelance consultant in weight loss and polycystic ovarian syndrome management, offering personalized one-to-one coaching to individuals navigating metabolic and hormonal challenges. She has also served as a Women Ascension Fellow, contributing to different skill development and women health initiatives, and has previously worked as a nutritionist in multiple hospitals specializing in therapeutic diet, planning, and patient counseling. Beyond her technical expertise, she is deeply passionate about communication, mentorship, and creating meaningful spaces for wellness transformation. With much ado, please join me in warmly welcoming Miss Mentor Nurul Huda, our speaker for today's session. Ma'am, we are truly honored to have you with us. The stage is all yours. Thank you, ma'am.
Thank you so much, Maria, for introducing me. And hello, everyone. I hope you guys are doing great. And I'm super happy to have you all here from different countries. So, as Maria shared, the topic
Good
that we
evening,
will be having a
everyone.
discussion on. Okay, so I will just continue. So, the topic that we are going to discuss today is related to the well-being, because in today world where we are in a constant rush, we are eating in a rush, we are thinking in a rush, even when we are taking a rest, we are in a constant rush. So which means we often think when we talk about the concept of health, we often think that health is just the absence of disease. Like, for example, if you are not ill, if you're not having any kind of disease, it means you are healthy. But the concept of well-being, it is far beyond this simply simple absence of disease. So today session, I would be focusing on three different approaches that will ensure that you are at a state of well-being, or you are healthy, not just physically but also mentally, emotionally, and you are having a better lifestyle. So I'm just moving towards the second slide. Just let me know if it's visible to everyone. Okay. So when we talk about the well-being, it's not just about eating right. It's not just about moving, doing some kind of physical activity or walk whenever we are going towards our university, school, or to our workplace. It actually covers three basic aspects, or you can say three pillars, and all three are interconnected. If any one pillar, if any one aspect is missing or is disturbed, it is going to affect the rest of the two pillars, and you will not be in a state of well-being. The very first one is mindfulness. Mindfulness means when you are living, when you are eating, when you are thinking consciously, being aware of yourself, being aware of your emotions, your environment. So it actually builds the emotional and mental foundation for the well-being. Then comes the nutrition. We will talk in detail what actually comes in the mindfulness, what actually includes when we talk about the nutrition. It's not about how much we are eating. Like when we think of nutrition, we might think like it's about the portion control. We have to eat less, we have to avoid certain kind of foods, but it is much more than that. It's what are you eating, in what way you are eating. So nutrition basically builds the physical foundation of your well-being. And last is the lifestyle, your behaviors, your daily routines. And it has some factors that is even more important than diet and physical activity. For example, if you are having a physically active lifestyle, you are eating healthy, you are consuming good foods or healthy foods, the common concept of, healthy foods. But if you are missing on two very important things that actually falls under the lifestyle category, that actually falls under the behavioral category, you won't be in a state of well-being. You won't be able to enjoy a healthy lifestyle. So we will cover all those factors, all those aspects. So starting with the mindfulness, the third slides. Mindfulness, as I told earlier, it's about how aware you are of your environment, of your emotions, of your body, of your practices. Like what we actually think of mindfulness is doing some kind of meditation, like sitting on a cushion and you are doing meditation, just a specific pose and a silence for a few minutes. But actually, it is much more than that. What it actually is, it's about how you are eating, if you're eating mindfully or not, if you are living, if you are talking, if you are moving mindfully or not. And similarly, the scrolling. Sometimes, like in today's world, we all have phones, we all have access to social media, and most of the times we are scrolling mindlessly. Whatever the content we come across, we consume it. We are not very aware. Sometimes it's just kind of some funny content, meme based, and then it's some quotation, then it's some stress related thing, some sad stuff. And there's a constant shift of emotions. You are feeling happy at one moment and then you are feeling stressed, or you sometimes even content make you feel very exhausted, or you cry. So there's a constant shift of emotions, and this means you are scrolling mindlessly, and it's not a very healthy practice. The constant shift in your emotion is not a very healthy practice for your brain. So what actually happens when you bring the concept of mindfulness, for example, what it actually means by eating mindfully? When we are eating, take a pause and think. You are eating, either it's hunger, you are eating out of hunger, you are hungry, you want to eat, or it's just a trigger, an emotional trigger, or you are just eating out of the stress. Like whenever we feel stress, some of us do binge eating, right? And then you feel stress, then you feel guilty for that activity. So when we take pause, when we become mindful, of our eating patterns, and we think either it's hunger or it's an emotional trigger or it's some, stress. When we differentiate between these cues, it actually means you are being mindful of your eating patterns, and this is going to help you have a healthy lifestyle. And similarly, when we talk about moving, by moving I means being physically active, doing some kind of workout or doing some kind of physical activity. When you bring the factor of mindfulness to your physical activity, it doesn't feel like a punishment. For example, we are doing job, we are students, there are multiple side hustles, there are multiple activities and a long list of in your to do list. And when you add another thing like now I have to do exercise, or now I have to go to gym and I have to spend 1 or 2 hours in gym doing the exercise, it feels like a chore, it feels like a burden. But when you become mindful, when you perceive things in a different way, that being active, if you are being active, if you are incorporating a workout, a strength training session, just for 30 minutes, a good workout of 20 to 30 minutes, it won't feel like a punishment. It will become a nourishment to your body, to your mind, because movement, or you can say the physical activity, it's not just going to uh, improve your physical health, it has tremendous benefits on your emotional health, on your mental health. So what actually happens when you are missing on the factor of mindfulness, it actually leads to stress. It increases your stress level, and when you have higher stress level, it disrupts your gut health, it increases the risk of metabolic diseases or non-communicable diseases, specifically when your stress level is for a longer duration. If you are not managing your stress level, if you are not doing any kind of activity to relieve your stress, it can be journaling, it can be a simple walk, it can be a discussion with your fellow, with your friend, with a person you love. So if you are not doing any kind of activity, if you are not seeking any help on how you can manage your stress, and it stays for a longer time, it becomes chronic stress. And this chronic stress is going to disrupt your sleep cycle. It is going to you can say, it will increase the risk of non-communicable diseases. So you can say, if you practice mindfulness practices, just doing a regular mindfulness practice, it can reduce your stress up to 30 to 40%. And there is this interesting study that I came across when I was studying for this session, where when I was preparing for this session today, regarding the mindfulness, that average attention span of an adult human, the average attention span used to be 150 seconds. By this attention span, it actually means that when you start doing a task, for example, you are working on some assignment, you start your assignment, you have opened the Microsoft Word, and you are writing it. So without being distracted by any notification, by any email or any sort of other distraction, without being distracted, focusing on that specific things, it used to be, the average attention span used to be 150 seconds in 2004 when the study was conducted. And then when in previous year it decreases from 150 to 75, and at present, when the study was again conducted on the participants, they came across that the attention span has reduced from 150 seconds to 47 seconds, which shows that the use of digital devices, the constant rush we are in, and the mindfulness, the lack of mindfulness in our day-to-day activities, in our life, in our routine, has actually decreased our attention span. And this is disrupting with our brain. This is actually increasing our stress level, because when you have a very low attention span, it actually increases your stress level. It makes you it makes your brain overstimulated and hyperactive, and you don't feel yourself at calm or at peace. So this was basically a research conducted by American Psychological Association, under that organization. So that is the about the mindfulness, that it's not just about doing a meditation practice, it's about bringing the factor of mindfulness, bringing the factor of being conscious and aware of each and every habit you're eating, you're scrolling, you're living, whatever you are doing. Next comes the nutrition. When we talk about the nutrition, the very common concept is about the calories. For example, an average human needs approximately 2000 calories. So if we are consuming 2000 calories, it's okay, that's a good thing. You are maintaining your health, you are maintaining your weight. But if you want to have a healthy lifestyle, if you want to be healthy, or if you want to be in a state of well-being, then you have to consider not just the calories, not just the how much you are eating factor, but you also have to consider two other aspects. That is what we eat. It's not just about the calories, it's about from what sources you are consuming your calories. Is it only from the carbs? Are you taking enough proteins? Are you adding variety to your food? Is there any vegetable sources, fruit sources? Are you consuming nuts, seeds? Although there are six food groups: dairy, then seeds, nuts, fruits, vegetables, carbs, and proteins. Carbs is sorry, carbs compose the major portion of our food, but we have to add variety in our foods in order to be a state of well-being. So you have to take enough protein, you have to take multiple food groups, for example fruits and vegetables, so you can actually avoid the hidden hunger. So there is like two kind of hunger. One hunger we know when we feel hungry we eat. Then there is this hidden hunger which actually is called the micronutrient deficiency. When your body is receiving enough calories, you are eating protein, you are eating carbs, you are taking fats, but your body is deficient of certain micronutrients, which means the minerals, for example iron, for example calcium, for example these are zinc. These are the most common deficiencies that is not just deficient in our country like in Pakistan, but in also many developing countries. They are struggling with iron deficiency and zinc deficiency, specifically among the children and the pregnant women and the woman overall, because we have greater needs for the iron due to the physiological needs. And secondly, the vitamins, the most common vitamin deficiencies are vitamin D, because we don't have enough exposure to the sunlight. And vitamin D is there is in our day-to-day life what we are consuming. Only dairy and fatty fish is actually the sources of vitamin D. And most of the times we are consuming foods that are not very rich source of vitamin D, and that is the reason it is among the common deficiencies. So in nutrition, we have talked about the calories, the quantity. You have to be mindful about how much you are eating, and you have to be mindful about what you are eating. Are you taking enough proteins? Are you adding variety in your foods? And then how we are eating. For example, I have added two pictures. The one is being mindful about whatever they are eating, and the other is using digital device. For example, phones. We often find, there is you often see some kind of content on social media that you just wasted an hour to find a good movie or a good drama or a good video to watch while you are eating. So when you are eating and when you are watching some content or you are using your mobile phone, it actually brings away the factor of mindfulness and you overeat, you binge eat. Sometimes when we are watching movie, we take a lot of snacks with us, and we just don't realize when they end, which means that we are not very mindful of our portion sizes of what we are eating. So this is actually harmful for your body, and this is actually leads to overeating. Overeating means you are going to gain weight, you are going to gain weight, and this will automatically increase the risk of different diseases in the longer run. And there is another thing when we talk about the nutrition. There is, you might have heard of the hormone serotonin, the happy hormone that makes you feel happy, that makes you feel good. So 90% of this hormone is released from your gut, which means if you are not having a healthy gut, if you are not taking care of your gut, your GIT tract, gastrointestinal, your stomach, your intestines, that forms your gut, it means you are actually compromising on 90% of your serotonin. That is the reason when we have stomach issues, basically there are three S. You can say three S that are connected with each other. The first is sleep, second S is stress, and the third S is stomach. These three components are interconnected with each other. If you have high stress level, it is going to disturb your sleep. And if you have disturbed sleep and stress patterns, it is going to disrupt your stomach, your gut. And automatically, this will affect your gut, this will affect the production of serotonin, the happy hormone, and it will affect your emotional regulation, your overall well being. And you'll feel more exhausted. So this is an interesting thing, because when we think of hormones, we often link it with brain, that brain is responsible for producing these hormones, but actually gut is also your second brain. It actually controls your emotions, just like I have shared this fact with you guys. So this was nutrition, and the last factor is the lifestyle. We have talked about what we are eating, we have talked about the mindfulness, then comes the lifestyle, the stress, the sleep, the movement, and the connection. These four covers a major part of your lifestyle, apart like your routine, your habits. So when it comes to, like, I have deal with multiple clients, with the women who have PCOS, with diabetes, people who want to lose weight, people who want to lose fat, want to gain weight. Every time I tell this to my clients that diet is important, workout is important, doing strength training or doing any kind of physical activity is important. But what is even more important, more significant than these two factors, than diet and than your physical activity, what even more important is your stress, your sleep. If you are not managing your stress, if you are not sleeping enough, and not just sleeping enough, but you are not having quality sleep, you are not going to achieve your desired health goal. You won't be able to lose fat efficiently, you won't be able to feel good, you won't be able to manage your hormones, you regulate your hormones, manage your overall health, manage your metabolism. So stress and sleep, they both are interconnected. If you have high stress level, it is going to disturb your sleep. If you are not sleeping enough, it will increase your stress level. It will increase your cortisol. Cortisol is basically a hormone that makes you feel alert, that makes you alert. And if the cortisol level is higher for the longer durations, it can do that, it can have a detrimental effect on your body. And that is one of the leading cause, because we one of the very prevalent issue is the PCOS, polycystic ovarian syndrome, very common issue in teenagers, in adolescent girls, and in adults girl. So that the very significant reason behind the prevailing PCOS issue, and similarly PCOS and other metabolic issues, is people are compromising, people are not managing their stress level and their sleep cycle and their sleep. Okay. And then comes the movement. People who are not active, they have comparatively higher risk, 20 to 30% higher mortality risk. Because when you are not moving enough, it means you are not in a state of well-being. You won't have a better emotional and hormonal regulation. You want me not active, having a sedentary lifestyle means you will be gaining, you will have a higher risk of developing non-communicable diseases, obesity, becoming overweight. And obesity is actually the main factor behind all the non-communicable diseases. So if you are moving more, if you are doing not just the cardio, not just the walk, but also incorporating strength training, you lifting any weight, either your body weight or dumbbells or barbells or any kind of external weight. So it is another thing that comes under the lifestyle. And last is the connection. You are eating right, you are moving well, moving enough, you are sleeping enough. Equally important is a connection, making social connections, with your connection with your friends, with your spouses, with your family, with the colleagues. If you have a strong connection, and if you are socially active, it also improves your stress level, it also decreases the risk of anxiety, depression. Like, just like we are all are here, and this is also kind of social interaction and social connection. You are educating yourself, you are meeting new people, we are having a discussion, and you get to know new things, and that might help you in improving your lifestyle, in improving your health, in improving not just your own health, but also the health of your loved ones, and you can play a role in community. So this type of connection actually makes you more productive, and it actually relieves your stress, and you feel more happy. So these are the small habits, small routines, small changes in your life that can have great impacts on our well-being, on our health. So just to have a more emphasis on the stress and sleep cycle. I've said that they are even more important than your diet and then your physical activity. If you have high stress level, it is going to increase the cortisol, that is a stress hormone. And if it stays higher in your blood for a longer time, it is going to disrupt your stomach, which means poor gut health, poor serotonin production and release, and you will have not just physically, you will feel ill or sick, will also feel mentally or emotionally exhausted, more episodes of burnout, and it will also disrupt your sleep. And when your sleep is disturbed, your hormonal balance will disturb. You will face more high risk of hormonal imbalances and metabolic syndrome and metabolic abnormalities. And then you will feel more cravings for the food. Why have I did this craving thing? Because it might feel like not a very great problem, but some of us do experience great cravings, specifically for the carbohydrates, for the sugars. And when you overeat, it actually further deteriorates its present condition. It further adds to the the health problems. And lastly, the metabolic, the non-communicable diseases, the diabetes, the heart rate, the heart diseases, and obesity, the hypertension. These all are linked not just with our diet, but also with the sleep cycle. As I've said, that if your sleep and your stress is disturbed, it is going to affect your stomach. And if your stomach is disturbed, whatever you are eating, you won't be able to avail the full benefit of that specific thing. If even if you are eating proteins, even if you are eating multiple food sources, nuts and seeds. But if you are not, if your sleep is disturbed, if you have high stress level, your body won't be able to process that food efficiently, and you will not receive the nutrients efficient way, and it will not give you the benefit that you deserve, that your body needs. And another thing is, sleep is your body natural repair system. Just like we are using phone, and when we overuse it or when the storage is full, so it usually the phone get warm and we let it cool down so we can use it efficiently. And similarly, when we are using, there are numerous appliances in our day-to-day life, the cars or any home appliances, we go for the maintenance of that appliance so we can use it for the longer time. So similarly, our body also needs time to get rest, to regulate itself. And sleep is that natural system, the inbuilt system in you, that help your body repair, your brain remove the waste, your brain relieves the stress, your muscles get relaxed, your muscles build more, because you need rest, you need sleep for your emotional regulation, for your hormonal regulation. So these are actually, so these were the actually three major approaches that is very crucial if you want to be in a state of well-being, if you want to be healthy. And it all starts from individual. When you are focusing, when you are implementing or execution, whatever you have learned, when you have educated yourself, you go for the implementation or execution of that knowledge. And when individuals are empowered, when individuals are healthy, it means the community is going to be healthy. So, empowering collective awareness and shared responsibility, sustainable health begins at the community level where habits become culture. Like starting from the individual, when you focus on building habits, then you play role. For example, in this session, you are educating yourself. You will be focusing on the execution thing, and you will be educating people around you. So this is how the collaboration works. This is how partnerships work, and this is how community improves and community thrives. And lastly, collaboration is the new prevention. When you collaborate, different sectors collaborate, education, the workplace, and the community. For example, in education, how you can, true well-being is built when every system aligns to support it. For example, how education sector can support it by educating people about the ways of how you can manage your sleep, on how you can get quality sleep, on how you can manage your stress level, on how you can eat mindfully, and what actually your body needs. What are your body requirements for a specific nutrient, for a mineral, for a vitamin, and how you can avoid deficiencies. So education sector is going to play a major role play this role in educating, because once you are educated, then you are going to build habits, then you are going to make changes in your lifestyle. The workplaces can play a role by providing you with the resources, by providing you with mindfulness breaks, or arranging programs where you can educate yourself, where you can practice all the things, where you have access to the resources, where you have access to the food choices. For example, if I'm talking about the healthy food choices, that you have to add multiple food groups, one must have access to the knowledge, and one must have access to those food groups, so that we can bring improvements in our lifestyle. So that was all about the approaches, where we talked about the well-being, the mindfulness, the nutrition, and the lifestyle. When we combine all these three pillars, because these three are interconnected, if you are focusing on only one thing and the rest of the two things, or any of each factor is missing, you won't be able to enjoy that well-being state, or you won't be able to enjoy, you might be physically healthy, but you will feel emotionally exhausted if you are not practicing mindfulness, if you are not managing your stress level. So we can now move towards the question answer session. If you have any question regarding these things, on how you can, do things. We have learned about the importance of things, but you might be having questions about how we can actually implement. So I guess we can have a question answer session now.
Thank you, ma'am. Thank you so much, ma'am, for that lightning session. So we will now open the floor for question and reflection. So, audience, please feel free to type any question in the chat or raise your hand, and I will take them one by one.
Okay, so I'm going through some comments. So Sandra, if I am pronouncing your name right, she have shared that she used to believe that managing my food is enough. I need to exercise. And yes, exactly. Your food is only one part of being healthy or being in a state of well-being. You have to focus on exercise, and you have to focus on improving your stress, on improving your sleep as well. And that's how you can become truly healthy. So how you can use this holistic approach to help women with PCS. So, when we talk about the PCOS, the polycystic ovarian syndrome, it's a hormonal imbalance. It's a hormonal disorder. So, most of the patients, most of the clients that I have dealt with, mostly they have a problem with their stress level and their sleep cycle. Because there are, you might have seen people, you might have met women or females that whose diet quality is also not very good, but they are not suffering with PCOS. And the very reason is that there may be differences in the lifestyle. Maybe they are sleeping well, they are managing their stress level efficiently, and that is the reason they are not suffering with any kind of hormonal imbalance. So if you want to balance, for example, if you have PCOS, then you have to consider all these factors. You have to improve your diet, like incorporating protein in your diet, because what actually main reason in PCOS, in developing PCOS, is your body has more fat and less muscle. More fat means more cravings, more fat means insulin resistance, which means your body hormonal imbalance, and you won't be able to process normally. You will experience symptoms like brain fog. uh, you won't be able to focus on your day-to-day life efficiently. You will feel more cravings. So what you have to do is focus on your diet quality, and address your nutrient deficiencies, because in PCOS you are deficient in certain nutrients which are actually further worsening your symptoms. So go for the blood test or biochemical analysis and find out the deficiencies, and then accordingly modify your diet, or if any need of adding supplement. Focus on improving your sleep, not just the quantity, 7 to 8 hours of sleep, but also focusing on the quality, and managing your lifestyle. If you are, for example, if you are eating outside, then you have to consider the quantity. If you are eating outside, then you have to consider the quality. And managing your lifestyle, if you are eating outside, then you have to consider the quantity. And managing your lifestyle, if you are eating outside, then you have to consider the quality. that you can do. For example, you can do journaling. When you write your thoughts, when you do self-reflection, it actually gives you clarity about your feelings and about your emotions. And you get to know about the origin, like why you are feeling this way and what is the reason behind what you are feeling. Is there any question?
Yes, there is a question in the chat that what is your recommendation for those people who have family problems or economic issues? So how can they manage their diet?
Okay, so what is your recommendation for who they have family problems? So it all starts with small habits, because I have, like, we get to know that we have to improve our diet, we have to improve our physical activity, we have to improve our mindfulness and everything. So start with small habits that you can actually practice. For example, if you feel like you have economic issues and you can't afford that much good diet, first focus on other things. Diet quality, whatever your current diet pattern is, go with that, but improve your sleep, improve your stress. If you have high stress level, go, like, do journaling, do breathing exercises, do walk. When you do these small habits, it will automatically help you lower your stress level. You will feel more nourished, you will feel more at peace, and eventually and gradually, whenever you know the economic issues, the major economic issues due to this, that we can afford like carbs, but we are actually missing out on proteins and on are missing out on the micronutrients. For if you can't improve your diet quality in that way, you can focus on improving your rest of the elements until you focus on diet, because all those things are important and all those things can ensure a healthy lifestyle and and a state of well-being. So if you have any kind of such problems, what you can do is to focus on other elements, so at least we can do improvements on that factor. Focus on your sleep, focus on your stress, focus on your physical activity, so that you can lower the risk and you can improve your health. And once you have done these things, it will help you become more productive. And automatically, we all are doing something for our life. We are doing jobs, or we are studying, or whatever we are doing. These changes in our lifestyle, by lifestyle I means in your physical activity, in your stress and sleep and other factors, this will make you more productive. And when you are more productive, you can do more in less time, and in the longer run, you will be able to afford all those things, because it's about the resources, but it also about our will to improve our life. So I hope it gives you the clarity.
Thank you, ma'am, for answering the question. There is another question from Nabila. How a person can reduce his or her weight that is suffering from inflammatory bowel disease?
Okay, so Nabila, about the inflammatory bowel disease, as a dietitian, what I would say is we can suggest the dietary modification, the lifestyle modification only after knowing the exact cause, the symptoms, whatever you are experiencing, and then we will accordingly focus on where we are lacking. Because obviously, if you have IBD, inflammatory bowel disease, we first have to focus on addressing this problem. We first have to focus on our gut health. Once we have managed it, our second goal would be the weight. Because if your gut is not healthy, if your gut is not processing the nutrients in a very efficient way or in a good way, in a way that is supposed to, we won't be able to achieve our weight goals. So sometimes we are not able to gain weight, sometimes people want to lose weight, but their gut is disturbed and they are unable to achieve their health goal. So first, you will be addressing the inflammatory bowel disease. You can, always seek professional help, a doctor plus a dietitian, because a doctor will help you in the diagnosis and whatever, if in case any medication is needed. But in inflammatory bowel disease, the major focus, you need to focus on your diet as well. So once you have addressed the inflammatory bowel disease, the symptoms, the root cause exactly, then you can work on your weight as well. So I can't suggest many recommendations, but because I would be needing a detailed history of what you are suffering and what are the symptoms and what actually struggle is. So all otherwise, a simple rule to lose weight is the calorie deficit. Eat less, eat right, and that is how you are going to lose weight. But sometimes we are having we are suffering with the hormonal imbalances, or just like you have stated, any gut health issue, then it makes things a bit complicated and it needs proper attention and a proper assessment.
Okay, ma'am. There is another question from Madina. How can we control our minds? Sometimes I'm overthinking and I can't control it.
Okay, so that's a very good question, and that is very common. Even sometimes I myself overthink over little things that might apparently feels like a little, but for us, it is of a significant importance. So, what I would suggest is every time like overthinking, write down. Journaling is what helped me a lot. I would just share my experiences because every experience is different, and what I always recommend when it comes to your mental health, your emotional health, always seek for professional help. If you are unable to regulate your emotions, then seek out for the professional help because they are going to give you more better and a personalized solution for your problem. But when you are overthinking, start writing down your emotions, whatever you are experiencing, your anger, your happiness, or any emotion that you are having at that time. When you write your emotions, it actually relieves your stress, it calms your brains, and it gives you clarity about your emotion, why you are feeling this way, why you are overthinking. When you go to the origin of that emotion, it actually this is going to, when you do this exercise, like do the journaling, write your emotions, and find out the origin, why you are overthinking on this specific incident, why you are feeling this way. When you will do the reflection, like do the self reflection, and you will put attention on your emotion, you will find a way to think less and do more action on how you can avoid or how you can regulate your specific emotion. So journaling can help, or you can have some kind of distraction. By distraction, I mean some kind of activity. For example, what I do whenever I feel stress is I cook some food for me, or I write. Writing is something that I really love, or writing blog or writing stories or something like that. Some people do painting, some do calligraphy, some do designing or art. So always have a second hobby where you can for the temporarily distract your mind from a specific thing, from overthinking, and at the same time also address your emotion, because overthinking always occurs when you are actually avoiding certain emotion, when you are not actually listening to your body. So when you start listening to your body, you will get to know why you're feeling. And once you have learned why behind your emotion, then it will become easier to manage it overall. Like this is the general recommendation. I won't be able to help you in a very good way because my expert is not in this field. But if you think things are becoming out of control, or if you are not able to manage and it is going to is affecting your day-to-day life, then you can always seek professional help, or you can take recommendations from some professional.
Okay, ma'am. There is another question for Junaid. If I'm mispronouncing, sorry for the mistake. I have a colleague who continuously get drunk at the end of the month. This might off from what you presented, but I'm thinking of his mental health. The person has been sent for counseling, but he is well for about 15 days in a month. And other days he comes drunk and he is asked to go home, to go back home. How can we help this person and which can be effective for his well being?
Okay, so give me a minute. This might. Okay, so what I've getting from this question is your friend or the person you know is seeking professional help, and he is going for the counseling and he's good just for the 15 days, and rest of the 15 days he go for the drinking and not feel well, right? So how we can help that person? So, what I would say is to know the reason why because I don't have much experience on this specific thing, on the mental health thing. So, what I would just suggest is to ask the counselor that 15 days things go good, go well, but rest of the 15 days or rest of the month, things become complicated in the similar way. So, what the person who is drinking or the person who is struggling with this thing or with the stress or whatever they are experiencing, what they can do to avoid this certain situation or certain experience. So they can guide you in a better way because the counselor knows in detail what actually the person is going through, the why and the reason behind their action. So they can help you figure out, they can help figure out that person, what they can help, how what will be effective for that person if they want to work on their well-being. Because well-being covers different aspects. Their nutrition, they should focus on their nutrition, they should focus on being mindful. And when it comes to lifestyle, there is something this regarding stress, they can discuss it with the counselor and they can like help them in a better way.
Thank you, ma'am. There is a question from Maria. I have white spots and thin lining on my skin. Further, I feel weakness and breathlessness after exercise. Is it sign of deficiency and what should I do about it?
Okay, so yes, these signs, these symptoms basically are an indication of any deficiency. For example, you mentioned whenever you do exercise, you feel breathlessness and weakness. It is an indication that you might be having iron deficiency. So I would suggest you to go for the blood test. You can do the CBC, complete blood count, and go for the CBC. And as you have said, thin linings, I don't exactly get what you meant by thin linings, but white spots usually can be an indication of your low calcium level. So add variety of your diets, add dairy products, the milk and the yogurt. They are the major sources for the calcium. And you can also go for some test for like bone mineral density test for your deficiencies too. Because first we have to go for the biochemical assessment or do the necessary tests. So exactly we can diagnose, but these are the indications that there can be calcium deficiency, there can be iron deficiency, or might be possible vitamin B12 or folate deficiency. So they can be like multiple reasons. So to know exactly, I would suggest you to go for the blood test, CBC, and some bone test, bone density test. And that can help you in understanding what are the root causes. And then accordingly, you can modify your diet. And if there is deficiency, severe deficiency, you can ask for the supplements from a professional, health professional.
Thank you, ma'am. There is a question from Wang. Uh, why is that even when people go through stress, they still add on weight? Because I, for one, I am if I am stressed or disturbed, I see myself adding on weight irrespective of how its severity.
Okay, so just like I said, stress. When you have high stress level, I will tell you back science behind this gaining weight when you have high stress level. So when you have high stress level, your sleep would be disturbed. Even if your sleep is okay, you are taking 7 to 8 hours of sleep, your sleep quality would be affected. When your sleep is disturbed, when your stress level is high, it is going to increase your cortisol level. Cortisol is a hormone that, if it stays higher in your blood level for the longer time, it is going to gain you weight. It is going to accumulate fat in your body. Even if you are eating enough, even if you are eating not more, but your body will be storing all the calories rather than utilizing it to perform well, to function well. So when you have high stress level, you want, even if you are eating enough, you won't feel that much nourished, you won't feel that much efficient, you will feel weakness, you will feel fatigue, plus you will also start gaining weight. So basically you have to manage your stress, the triggers behind your stress. And another thing that is linked to stress, when you have high stress level, you have greater cravings for the sweet things, for the carbohydrates. The cortisol also actually increase your cravings for certain foods, and when you have cravings, you overeat, and it leads to weight gain. So that is one reason. So stress is like very important. What you have to do if you want to maintain your weight, you have to maintain your diet as well, your physical activity, plus do things for managing your stress as well.
Okay, ma'am. There is another question from Mehtab. How can students manage stress, sleep, and nutrition, especially since most of their stress come from exams and academic pressure?
Okay, so how you can manage stress? What I would say, just like students, for example, if someone is student, someone is doing a job, there are multiple side hustles, there are multiple day-to-day life activities, and it do feel like now we have to manage our sleep, we have to manage our nutrition, we have to manage this and this and this, and there are so many things, and it makes us feel exhausted. So remember, the changes that you are going to make for your well-being, for your health, it is not, you are not going to do these things for just a few months or for a few years. You are going to do it for your whole life. So small with gradual and small steps. Start with very small steps. Just focus on one thing at a time. For example, if you have, I can understand, I myself am doing my research, and there are lots going, and you do have stress level, you can't avoid. Stress is like inevitable, but it's how you manage your stress. Always have a hobby that can help you relieve your stress, just like I have mentioned, some painting or reading books or creating some kind of art or things like that, and focus on one thing at a time. Just start with improving your sleep quality. Leave the quantity of sleep. Maybe for the time being, it might feel like I have to sleep for 7 to 8 hours, and how I can do this, I have to do so many things, and it do feel like sleeping is wasting time when it actually is not. But start with improving your sleep quality. How you can improve your sleep quality: avoid any digital device 1 hour before you go to sleep. Expose yourself in the morning to sunlight just for 10 to 15 minutes, and have a consistent sleep wake cycle. When you are like sleeping at the same time and waking up at the same time every day, this will you can say improve your sleep quality. So just start with one thing, improve your sleep quality, then move towards the sleep quantity, then gradually make changes in your nutrition. Just start with eating healthy food. By healthy food means 80% healthy foods and 20% the foods that you love, even if it's junk, even if it's some fast food or something. But 80% of the time, food consume healthy foods. So just focus on starting or focusing on one step at a time. Once you have followed this specific habit for a week, then add another habit and follow it. So it will become your habit and it will become automatic. So this is how you can manage multiple things, and you can incorporate these tasks, which for now it do feel like a lot of work, but when you have built habits, it things will automatically happen. It will become your habit, it will become your routine, and you won't have to spend so much energy or so much thinking on that specific thing.
Thank you, ma'am. There is a question from Rifat. I have a severe migraine issue and I had anemia a few years ago. Although my doctor recommended a healthy diet, I am struggling to focus on it. Do you have any suggestions on how I can stick to my diet?
Okay, so that's a very good question, because uh, you have to remember that every person, every health professional has expertise in specific domain. When I talk about emotional health, I can't suggest you any kind of advice, any kind of therapy, or any kind of practice that you have to do, because I don't have expertise, and maybe my recommendation won't be that much effective because I don't have the exact knowledge. So you will seek psychologist. When it comes to diet, a doctor can give general advices, but since they are not personalized, they are not customized, or you can say addressing they are just coming up with the general guidelines. Okay, like for example, eat healthy, don't eat fast food, don't eat junk food, don't eat this and this and this. It feels like a restrictive eating, and it becomes very difficult to stick that kind of diet. So how dietitian can help you, and why you need to, for example, if you are struggling with sticking to your diet, it actually, the reason is it's not either practical, or you might not be enjoying that diet. And when you are not enjoying something, you can't follow that specific thing for a longer time. So what you need to do is you have to, for example, if you want, you can ask for a dietitian that can design everything, all the diet as per your preferences. Because when a dietitian, why I am like explaining this, because this is a very common mistake that people do. They ask non-professionals, and they give advices which are not very practical, which are very hard to stick with, and they are not very much that effective because you can't stay consistent with them. But when a dietitian plans things for you, it actually not only considered your deficiencies. For example, if I'm a dietitian and you ask me how I can help you with anemia, I am not going to ask just for the thing like you have iron deficiency, consume this and this and this. I'm going to consider your economic status. I'm going to consider your preferences, your likings and dislikings for food. If I'm suggesting you a source, like for example, if I talk about the sources of iron, it is meat. But maybe you don't enjoy meat, you don't like meat, you are a vegan or you are a vegetarian, then we have to go to the towards the non-veg sources. Then in non-veg sources, there comes the spinach, there comes the lentils and legumes. But maybe you can't enjoy that foods, you don't love those foods that much. So how you can how you are going to manage all the things? You don't want to eat meat, you don't like legumes, but you have to eat. So here a dietitian can help you with personalizing things for you, for designing recipes in a way that you can enjoy. Because when you enjoy the process, when you enjoy your diet, you become more consistent and it will become easier, and it won't feel like following a specific diet. It will become a part of your routine, just like we do rest of the things. Just like we use phone and we enjoy the thing, it doesn't feel like chore, or it doesn't feel like a burden. Similarly, when you do things in a right way and as per your preferences, where you are not just considering your deficiencies, but also considering your likings, your preferences, and the practicality of the plan of whatever the recommendation is, then it becomes easier for you to stick with that specific diet with a specific pattern. I hope it
Um,
helped.
Thank you, ma'am. There is an other question, which will be the last question. What advice would you give to people who think being skinny means being beautiful? They starve themselves and use all kind of things to ensure that the food they eat doesn't interfere with their desired body size. And there are people who think that being very fat is a sign of living well, as they can afford all kind of food they want to eat.
Okay, just give me a minute. I think being skinny. Okay, so this is something that is with the, because when you have mentioned skinny means beautiful, you starve themselves, and this is psychological related stuff, because it is a condition. If it's extreme level, we call it as anorexia nervosa, where people starve themselves so they can have a weight, they can have less weight, because they think being skinny means beautiful, so they do the exact thing, same thing that you have mentioned. So what here actually need is not just a diet, but actually the counseling, where we can let people know where I mean they would be needing counseling in this regard, so that they can understand that being skinny is not beautiful, being healthy is beautiful. You can have a normal body weight, you can have ideal body weight, but in a healthy way. You can enjoy all the foods, but by being mindful, by controlling the portion. So at this point, they what they actually need, and what is the foremost priority, is the counseling. They need counseling regarding their food, so that they can have a healthy relationship with diet. Because here the problem is with the relationship with the food. So when they work on that relationship, when they will improve the relationship with food, and where they will understand what actually beautiful to them and what actually their goals are, and when we align all the things, then they are going to enjoy a healthy life. And the people who think that being very fat is a sign of living well, so this is a concept. This is just perspective. One is thinking being skinny is beautiful, another thing is being fat is beautiful. So what actually is needed is to understand the exact person's mindset, and then do the counseling accordingly. If they think being skinny is beautiful and they are struggling with their eating patterns, then we will do the counseling accordingly. And if the people think, let the people do their own things, what do you think is actually matters, and what are your goals, and what are your concerns, what are your struggles, this actually matters, and we will do things accordingly. Let people think whatever they want to think. Exactly, love yourself and being consistent, that is how you are going to enjoy a state of well-being.
Thank you so much, ma'am, for this insightful session. And now the floor is yours, Kanvi, ma'am.
Uh, Thank you, ma'am, for such a concise and well curated session. It is our privilege that we had you on this series, and this series would have not ended with a holistic answer to every question, every part of the series. So, thank you a lot, ma'am, for sparing your time and making it very concise and very to the point, and obviously very beneficial for the participants. We are really grateful that you came on stage and was a part of this series and concluded it on a very good note. Thank you a lot, ma'am.
You're welcome. It's my pleasure as well, and it was a very interactive session, and I loved responding to your questions. And I still there are many questions, so you can reach out to me on LinkedIn, or you can reach out to the moderators if there is anything that you want to discuss, or if you want any more session, you can share your suggestions with the moderator and with the Women Ascension, and they certainly is going to help you educate, is going to help you empower yourself with the knowledge, with the exact actions you can do. So yeah, I also
Yes,
enjoyed the session, and I
yes,
hope uh, it helped the participants.
yes, for sure, ma'am. I can see the responses. Actually, we have another session from another department scheduled, and we'll make sure that we will be sharing our LinkedIn, and participants will be reaching out to you personally or for another session as well as for the questions which are unanswered. Thank you so much, ma'am, and apologies that we could not take all questions of the participants, but we'll surely share your chat since we have our sessions soon. Thank you a lot, ma'am. And I would also like to thank the moderator for having a smooth orientation of the whole session, and also the participants who have been with us throughout the whole series. And I hope these series have made an impact in your life, and you can still recall these sessions since the recordings are available, and remind yourself about the importance of mental health in your life, and also the importance of mental health in your life of your loved ones. And we will see you all soon with another series or another sessions related to mental health. So make sure you stay tuned with Women Ascension for the same. Thank you so much. The